Have you ever wondered if some medical tests might actually do more harm than good after a certain age? What if I told you that not every checkup your doctor recommends is always necessary, especially after 65? Imagine going through tests, stress, and even treatments only to find out later that they may not have helped you at all. In fact, some could even put your health at risk. Let's talk about it. As we age, staying on top of our health becomes more important than ever. Regular checkups can catch problems early, improve quality of life, and even extend it. But here's something many people don't realize. More testing doesn't always mean better care. In some cases, especially after the age of 65, certain medical screenings can lead to overdiagnosis, unnecessary anxiety, and treatments that may not improve your life and might even make things worse. So today, I'm going to walk you through 5 medical checkups that many doctors quietly avoid for themselves after 65, and more importantly, why. Now, before we go any further, a quick note, this content is for educational purposes only and not medical advice. Always talk to your own healthcare provider before making decisions about your health. Alright, let's get into it. The first one might surprise you. Routine full body scans. It sounds like a smart idea, right? A scan that checks everything head to toe just to be safe. But in reality, these scans often pick up tiny abnormalities that would never cause problems in your lifetime. Think of it like this, your body is not perfect, especially as you age. Small harmless changes are normal, but a full body scan can turn these harmless findings into something that looks scary. And once something suspicious shows up, it usually leads to more tests, biopsies, stress, and sometimes even unnecessary treatments. For many people over 65, especially those without symptoms, these scans can create more fear than benefit. Now, I'm not saying imaging is bad. It's incredibly useful when there's a real reason, like symptoms or a known condition, but doing it just in case often isn't helpful. Moving on to the second one, PSA testing for prostate cancer. This one is a bit controversial. PSA tests measure a protein in the blood that can be elevated in prostate cancer. Sounds helpful, but here's the problem. As men age, PSA levels naturally rise, even without cancer. That means the test can give false alarms. And when that happens, it often leads to biopsies, which are invasive and not risk-free. Infections, bleeding, and anxiety are real concerns. Even more importantly, many prostate cancers grow very slowly. In men over 65 or 70, these cancers may never cause symptoms or affect lifespan. So instead of helping, the test can lead to overdiagnosis and treatments that may cause side effects like urinary problems or sexual dysfunction. That's why many doctors prefer a more individualized approach rather than routine PSA screening at older ages. Now let's pause for a second. If you're finding this helpful, make sure to subscribe to Dr. Waterling Hub for more simple, honest health information that actually makes a difference in your life. Alright, let's continue. Number 3, colonoscopies after a certain age. Now, colonoscopies are powerful tools. They can detect colon cancer early and even prevent it by removing polyps. But after age 65, and especially after 75, the benefits start to decrease for many people while the risks go up. The procedure itself is generally safe, but complications like bleeding or perforation become more likely with age. Plus, preparation for a colonoscopy can be physically draining, especially for older adults. If someone has had regular screenings with normal results, continuing frequent colonoscopies may not provide much additional benefit. Doctors often consider overall health, life expectancy, and past screening history before recommending another one. So again, it's not about avoiding care, it's about choosing the right care. Next, number 4, routine stress tests for the heart without symptoms. Stress tests are commonly used to check how well your heart handles physical activity. But here's the key point. They're most useful when there are symptoms like chest pain, shortness of breath, or known heart disease. In people over 65 who feel fine and have no symptoms, routine stress testing can sometimes lead to false positives. That means the test suggests a problem when there isn't one. And guess what happens next? More testing, more procedures, sometimes even unnecessary interventions like angiograms or stents. Each step carries its own risks. For healthy older adults without symptoms, many doctors avoid routine stress testing unless there's a clear reason. And finally, number 5, bone density tests too frequently. Bone density testing is important, especially for older adults at risk of osteoporosis. But doing it too often doesn't always provide useful information. Bone changes happen slowly. Testing every year may not show meaningful differences, but it can lead to unnecessary worry or medication changes. Most guidelines suggest spacing these tests out, sometimes every 2 to 5 years, depending on your risk level. Overtesting doesn't strengthen your bones, it just increases stress and healthcare costs. Now let's take a step back for a moment. You might be thinking, so should I stop getting checkups altogether? Absolutely not. The goal here isn't to avoid medical care. It's to make smarter, more personalized decisions. Good healthcare is not about doing more. It's about doing what actually helps you live better and longer. As we age, our bodies change. Our priorities change too. Quality of life becomes just as important as quantity. That's why many doctors focus on individualized care rather than routine, one-size-fits-all testing. They ask questions like, will this test actually improve this person's life? Will it change how we manage their health? Are the risks worth the potential benefits? These are the kinds of questions you should feel comfortable asking your doctor too. Because at the end of the day, the best healthcare decisions are made together with clear information and thoughtful discussion. And remember, skipping an unnecessary test doesn't mean you're ignoring your health. In many cases, it means you're protecting it. Now, before we wrap up, here's something important to keep in mind. Every person is different. Your health history, current conditions, lifestyle, and personal preferences all matter. What's unnecessary for one person may be essential for another. So always have open, honest conversations with your healthcare provider. Alright, if this video helped you see medical checkups in a new light, make sure to subscribe to Dr. Waterling Hub for more practical, no-nonsense health insights. Because the truth is, staying healthy isn't just about doing more tests, it's about making better choices. And sometimes the smartest decision is knowing when to say no. Stay informed, stay thoughtful, and before you go, let me leave you with something that might truly change the way you think about your health moving forward. Imagine two people, both over 65. One of them goes for every possible test, every year without question. The other takes a more thoughtful approach, focusing on symptoms, lifestyle, and meaningful screenings. Now here's the surprising part. Studies have shown that more testing doesn't always lead to better outcomes. In fact, in many cases, it leads to more procedures, more side effects, and more stress, without actually extending life. That's a hard truth to accept, but it's an important one. Because modern medicine is incredibly powerful, but it's not perfect. And when used without clear purpose, even good tools can create unnecessary problems. This is something many experienced doctors understand deeply. That's why, when it comes to their own health, they often choose carefully rather than automatically saying yes to every test. Let me give you a simple way to think about it. Every test you take should answer one important question. What will we do differently based on the result? If the answer is nothing, then it's worth asking whether the test is needed at all, because every test has three possible outcomes. It can reassure you, which is great. It can find a real problem, which can be helpful if it leads to meaningful treatment. Or it can find something unclear, something borderline, something that leads you down a long path of more testing, more worry, and sometimes unnecessary treatment. And that third outcome happens more often than most people realize, especially as we get older. Now, this doesn't mean you should avoid doctors or ignore your health. In fact, it's the opposite. It means you should become more engaged, more informed, and more intentional about your care. Focus on the things that truly make a difference. Staying physically active, eating a balanced, nutritious diet, managing stress, getting enough sleep, keeping your mind sharp and socially connected. These are the real pillars of healthy aging, and no scan or test can replace them. And when it comes to medical care, prioritize what actually improves your quality of life. Vaccinations, managing chronic conditions like blood pressure or diabetes, and addressing symptoms early. These are incredibly valuable, but random routine testing without a clear reason, that's where you want to pause and think. And here's something else that often gets overlooked. Peace of mind doesn't always come from doing more. Sometimes it comes from understanding your health well enough to know what you don't need. That kind of clarity can be incredibly empowering. Now, I want you to think about your next doctor's visit. Instead of just saying yes to everything, try asking a few simple questions. Do I really need this test at my age? What are the risks and benefits? How will this result change my care? These questions don't challenge your doctor. They help create better conversations and better decisions. And any good doctor will appreciate that, because the goal isn't just to live longer, it's to live better, to stay independent, to feel good in your body, to enjoy your life without unnecessary medical stress. That's what smart healthcare is all about. And if there's one message I hope you take away from today, it's this: more care is not always better care. Better care is thoughtful, personalized, and focused on what truly matters. So the next time someone suggests a test, don't be afraid to pause, ask questions, and make a decision that's right for you, not just routine. Now, if you found this video helpful, make sure to subscribe to Dr. Waterling Hub for more clear, honest, and practical health advice you can actually use in your daily life. And share this video with someone you care about, because this information could help them avoid unnecessary stress, procedures, and risks. Thank you for spending your time with me today. Take care of your health, but take care of it wisely. And I'll see you in the next video.